The little button that you press.
The gray one.
Oh,
Yep,
now
there
it
you
is. Okay, got it.
go.
Okay, at this time, we'll call this meeting to order. Roll call. Everyone is here. Everyone is present. Approval of the agenda. Do I have a motion to approve the agenda? Julie, a first.
Second.
Jeff, second. All in favor, say aye.
Aye.
Oppose? Next, we'll move to the approval of the December minutes.
I make a motion to approve.
A first, do I have a second? Virginia. Kathy, all in favor, say aye.
Aye.
Oppose?
Aye.
What do you?
On the excuse, I actually was attending the meeting via the internet last month, and I'm marked down as unexcused. I had
Okay.
COVID and couldn't come here.
Okay. Did we know she was on? No, I apologize because
Okay.
nobody told us and
I don't
we did
have
not
a,
see
I don't
you.
have a camera on my computer, so you
Okay.
wouldn't have seen my face.
No, we
No,
didn't.
because I did it at home. Yeah, because I
Okay,
had it.
thank you.
Yeah. So
I apologize. We did not know. So thank you. Okay, next we'll move to the citizen input. Do we have anything at this time? Then we'll move to COVID update. Cindy.
Good morning, everybody.
Morning.
Can you hear me? Okay, so I was just tallying numbers this morning because we've been out for a few days with the holidays. So I wanted to get the correct numbers for you. So as of this morning, total case count positive for Kewaunee County since the start is 2,164 cases. Of that, as of this morning, 81 is on our active caseload. Now, that is not including the cases coming in today. So I can tell you there's at least probably another 12 to 15 that are pending, waiting for my staff to get going on them this morning. We are now up to 32 deaths from COVID in the county. So we added one over the weekend. And 2,051 people have recovered basically from COVID. Okay. Changes that we're seeing right now or that we're dealing with vaccine issues. So we're hoping to get vaccine within the county soon. I know that our 2 nursing homes have been contacted and have either started or will be receiving their vaccine this week through the pharmacy program that is contacted through the state of Wisconsin with CVS and Walgreens. So those entities, the residents and the staff there, should be done by the end of the week, hopefully, if they haven't already received it. It is my understanding that some of our pharmacies will be receiving their vaccine this week as well. The health department is not. So let me tell you what's going on there. We put our contract in, met our deadline of November for the contract, November 20th, I believe it was. And then they contacted us on the 17th. They asked us to clarify what kind of clinic we were. Question mark, health department was the question. It was answered on the 18th for them. It was emailed to them on the 21st. It was again emailed twice on the 30th, and it was emailed to them again on the 31st. Apparently, there's a disconnect, and it has not been keyed in at the state level yet. So we remain in the pending category. I had a very long conversation with the state on Saturday afternoon at about 2:30, asking what in the world I can do to make that advance. And she said, I'll take it to my boss. I received word at 6 o'clock that I could probably expect to answer that question several more times because that's how messed up it is right now. So I took it to the head of the COVID vaccine efforts this morning at 6. So hopefully Michael will get back to me. I'm hoping before noon today with that answer. Otherwise, I will go further up the chain yet. So we know that we're going to get vaccine. We know that we have been confirmed as a vaccinator. It is just a glitch in their IT system, and that's why we haven't gotten our okay yet. So once we get the okay to advance out of pending, we need to fill out a survey. That survey asks information in regard to vaccine storage and handling and what we're capable of here for that. Long story short is I'm guessing we'll receive Moderna vaccine due to that vaccine storage and handling survey. And then from there, we will begin planning our clinics. We are intending to offer according to the state guidelines. So in category 1, there is 1A, 1B, and 1C. We have to start with 1A. Who falls into that? That will be our EMTs. Okay, so we're going to try to get rescue vaccinated as quickly as possible. We will try to get our funeral home staff vaccinated as quickly as possible. And we will try then to go further down the line and see who the pharmacies have not hit yet. It'll be our CVRF, nursing home residents and staff that we can do next. So we're going to follow their chain. Once we hit category 1B, that will include some of our essential workers, including our teachers. Okay, and that's a question that I've received quite frequently is when will we be doing teaching staff? They fall under 1B. And then from there, we'll finish out with fire, police. Those are all in category 1B. And then when we hit 1C, that's when more of our general public will be vaccinated. So right now, the health department does have a running list of people who are interested in vaccine and would like to be contacted when it becomes available. Some of those people have chronic health conditions. Some are seniors. Some just truly want their vaccine as soon as they can possibly get it. So we have that listed. We do not have a registry established yet for that because without having vaccine and knowing any dates, it's difficult to put together a registry saying you can register for a time to get a vaccine.
So that would be my question, I guess, is we don't know how many vaccines we're going to receive.
Correct.
And we have our essential workers, so the 1A tier, EMTs, funeral home staff, et cetera. Do we have an idea of how many of those people are eligible for 1A in the county? That, you know, we know if we get 100 vaccines, we have 110 essential workers or 80 or
So
whatever.
what we have is we have a number within those agencies, but we don't have a number yet of the people that have agreed to get the vaccine. And there's a difference. They
Mhm.
qualify, but they may not agree. And so with lessons learned over the last week and a half that I've been watching with some of the larger agencies and the health departments that did receive vaccine last week, which included Kenosha and Dane and some of those bigger counties, their comment was about 1/3 of the people that they thought, or 1/3, they vaccinated 1/3 of the people that they thought out of the entire group would qualify. So that is a problem, you know, because we can't reserve doses and we can't pull doses out unless we have a guarantee that they're going to show. So this vaccine, once you thaw it, you have 12 hours to use it if it's refrigerated. And once it's a multi-dose vial, which means that we should be getting 10 doses per vial. Once we pop that vial, it has to be used within 6 hours flat or it's discarded. So my goal is to hopefully have a backup list of people that we know that we can call on short notice and say, hey, we got 2 doses left, send 2 people over. And so that might be our police, our fire departments, that group of 1B that will qualify, but maybe aren't quite there yet.
Yeah.
So we're going to try to go through our 1As and then have those people on reserve. For instance, the health department staff, you know, maybe we're not the first people to get it, but we're the people at the end of the day to get it, or human service staff, or our veterans staff, or people that are dealing with individuals every day, but just, you know, we don't want to see a single
Don't
dose
waste
wasted. Exactly. We don't want to turn out to be like Grafton because that's quite a situation that they're in. So it's hard. I'm hoping to have a planning meeting this week, and that planning meeting will take place with emergency management, will help, you know, some of that logistic stuff, also with the sheriff's department, so that we have a plan for large groups, things that might get out of control, those kind of things. You know,
As a school district, I would think we'd want to make sure, okay, teachers, you're going to be in the 1B group, for example. How many of you
Correct.
want the vaccine?
Correct. And the other question that I have, because we have districts that cross lines. So for instance, in Luxembourg Casco, we have a large number of staff that reside in Brown County or even further, Outagamie and whatnot. So are we to use Kewaunee County issued vaccine on residents of other counties, or are they to go to their own county to get that? So those are questions that really need to be worked out, and we haven't gotten definite answers. Typically, what we do with our flu vaccine and everything else is when we go in, we give it because we're protecting our county. If those people are coming here, ultimately, that's who we want to protect. But, with Kewaunee, we're crossing over to Manitowoc. With Algoma, we cross into Dorr with a lot of staff. So we just want to make sure that the people here in this county are getting the vaccine that's entitled to them first.
Cindy, when you're talking about the pharmacies getting the vaccine, are they going to be vaccinating the general public?
They're not supposed to be.
That's
So
for
they
the
are supposed to
nursing-
be
the nursing
doing-
home
well, they're
residents?
supposed to be following that 1A, 1B, 1C tier. And they're all supposed to have a vaccination plan. Now, I haven't heard from any of them as to what their plan is, so I'm not sure. I know that we have reached out to all of our CBRFs and nursing homes, making sure that we knew how many staff and residents they had so that those vaccines will go there first. And then our EMS, we have constant contact with our EMS and those staff. We do actually a weekly mortuary survey with our local funeral homes and our coroner, and those people are on COVID units on a regular basis. So they are dealing directly with those patients, and therefore they fall up in that top tier. And we know exactly how many staff they have. So we're ready to cover those. Another answer I don't have yet is if we can actually transport this vaccine or if people will have to come to this building. There's some question on the transportation of it and breaking that cold chain. If we know exactly how many people are going to be in a facility and we thaw exactly that amount and everyone shows up, yeah, we're golden. But if we don't and we end up with vaccine, then that's thawed and shouldn't have been. You break that cold chain, we waste that vaccine. We don't want to go there either. So is it easier to have people come to us versus us to go to them? There's a lot of questions out there that need to be answered. Any other questions on the vaccine? I can tell you that the vaccine that I think we're going to get, it's 28 days apart between doses. So we'll be, what they do is they issue you your vaccine. So if they issue you 200 doses for a county or 500 doses, they reserve that exact same amount for you. And 1 month later, you get that identical shipment so that everyone is guaranteed their second dose if they start it.
How big is that window for the second dose? 28 days. So it does it mean by the 27th or the 29th day or
They can't get it before the 28th day. They can get it anytime after that.
up until a month even?
Yeah.
Okay.
Mhm. All right. Any other questions? That's my update for you for COVID right now then.
Then we'll move to the grant update.
I guess I have one more COVID update. So about a month or two ago, I told you that we were going to be receiving CARES funding that would carry us for 2 years. And that amount totaled $305,000 through November of 2022. About 2 weeks ago, every county in the state found out that that wasn't exactly accurate. The state had changed their mind. They had decided to reallocate that in a different way, and we're changing the pot. So as of right now, that 305 has turned to 145,000 for 6 months. And then after the 6 months, they'll reevaluate the need for money beyond that point. I think their thought process is that they hope that within 6 months' time, our contact tracing will drop down because our vaccine coverage will go up and we will start seeing an improvement within the community. And hopefully we won't have to be paying out the amount of money that we, do statewide for contact tracing daily. So I will keep you posted on that. So that would have been your ELC funding that is listed on the financials. And it doesn't come as a lump sum that they give you. It is reimbursed to you as you charge to that grant. So it's not that we'll receive the whole 145,000. That is what we have in our allotment available to us, and we can charge up to that.
And when does that start? From
Today.
January to June?
Yeah.
Okay.
Mm-hmm.
Can I ask you something else, Cindy, about contact tracing? So the schools have had some cases and this and that, and is the responsibility of contact tracing, does any of that fall on the school, or is it all part of what you guys do? Or who's ultimately responsible for that?
Ultimately, it's us.
Okay.
So we oversee it all. We work very closely with our school nurses in the public school systems. We have actually a document that is sent to each school nurse that keeps track of every staff that's positive, every student that's positive, every staff that is a contact of a positive, and every student that's a contact. And those dates are updated regularly so that they have a constant know of what we have as far as that information. Our school nurses have also been granted read-only access to our program where we do all that contact tracing in so they can look people up. When it comes to the parochial schools, it's 100% on us. So those parochial schools are not doing any contact tracing on their own. They're going 100% through the health department, and we guide them through that. We provide them letters that will explain to, like, say, a whole classroom. If we have to quarantine a classroom, we provide that letter with all the information and the dates on, signed by us with our contact information, so that parents aren't going back and calling the school and getting an answer that may or may not be accurate with the contact tracing. In addition, we handle all sports, which is sometimes a nightmare, I'm not going to lie. So when it comes to an athlete, a student athlete that is involved with either a positive or a contact, that goes through our agency. And then we are notifying full teams of quarantine dates and such. And it goes so far as that we notify opposing teams as well. So for instance, recently we had issues with, I believe it was 8th grade boys basketball in Algoma. We had positive cases on the team. Then we notified the opposing team, which unfortunately was Kewanee, 8th grade boys basketball. But then it came out that another kid tested positive, and then that affected Sevastopol, 8th grade boys basketball. So it's a chain effect. And unfortunately, in that kind of situation, it's hard not to quarantine an entire team, because if it's a starter that has it and they're literally having contact with everyone on that court, it gets very difficult.
So I have a question because that was my son. So they played on a Thursday and we got the phone call the following Wednesday. So that's when so Kewanee played them Thursday night. And the following Wednesday, we got the phone call to pick our kids up.
Well,
'cause
it's
he
very
was tested.
possible that that child didn't get tested till over the weekend, and then you get the result.
3
So
days.
if the child played symptomatic, we don't know that. And the damage is kind of done before that information gets to the health department. So as soon as we get that positive result, that's when it goes into effect. And for some kids, they may say, oh, well, I've had symptoms since, a week ago on whatever day. So then we have to go all the way back, and they may have played 2 or 3 games in that period of time. So it's very complicated. We also have wrestling going on right now, which I don't fully understand how you do that and not be in contact, because the contact is the issue. But so, we've had some teams of wrestling that have been affected as well. So, moving forward, we're being very cautious with winter sports. That's all I can tell you.
Is a fever still considered a symptom per se?
Yes.
Because it seems like there's a lot of people that have been no fever, but yet positive.
Correct. So fever and respiratory symptoms alone are key indicators that it could be COVID. However, if you have any 2 of the other symptoms, so say you had abdominal pain and loss of taste, or you had body aches and chills, 2 of those symptoms equal 1 respiratory.
And how
basically.
long do they figure that the person, once you're positive, that it could hang on? Like, how long have you seen
Yeah.
cases?
Well, so once you're deemed positive, you are thought to be able to shed that virus for 10 days. Therefore, you get a 10-day quarantine. But that's based on your symptom start time. Okay, so if you started symptoms on, say, the 10th, you're going to be quarantined through the 20th. That's your 10-day period. But your contagious period is 2 days prior to symptom start. So we go back to the 8th then and look at anyone that you've been in contact with. So the positive person can shed that virus for up to 10 days if they have a normal, healthy immune system. If it is someone who is compromised in any way, they can actually shed it for up to 20. So for people who are immunocompromised and suffering or hospitalized or whatnot, those people will be quarantined for 20 days.
What about symptoms though? I mean, if they, like, how long are some people carrying the symptoms of the chill? whatever?
Typically they're not released from quarantine until then. So most people are over with their symptoms by 10 days.
10 days.
Okay. Some people do have a lingering cough. We know that the cough does not go away 100%. So they're excused from their quarantine even if they have a slight lingering cough, but they have to have shown improvement on their symptoms.
All right, so that was COVID again. So
The
let's
grants.
go
Yeah,
back to
not
the
just to your-
grant update.
The other grants, does anyone have any questions? I don't have anything besides the CARES grant that has changed since the last time that I spoke to you. Otherwise, I think we're sitting pretty good financially for this upcoming year.
Okay, then we will go to the December monthly report.
So I believe that you all have that. You have some blanks at the top of your monthly report for the WIC contracted caseload. So your 12-month average would have been 207. The December initial number would be 205. Your November final number would be 203. And overall, we've maintained our contract caseload at 95%, which is where we need to be to maintain our funding. So we're right on track with where we need to be for WIC. Other things on here, you'll see our communicable disease caseload counts. We had 2,258 cases reported to us in the last month. 562 of those were confirmed to be positive COVID cases. There actually 500 and just under that. It might have been 560. There were a couple other cases that were reported as well of different diseases. But overall, our caseload has primarily been COVID when we're looking at that. Vaccine totals were somewhat low for the month. We don't do a whole lot of vaccinating in the month of December. Does anyone have any questions in regard to the office visits or the school visits or the meetings and conferences that you see listed? Okay.
Let's move to the agency updates.
I don't have a whole lot new to tell you. So right now, December was fairly quiet for us. We've been busy with COVID. We have just a few flu vaccine left. We still have about 100 for youth. So anyone under the age of 18 can get vaccinated for free through us. All they need to do is call. And we have less than 10 adult. 9 are left in the fridge for adult vaccine for influenza. The state is seeing a slow start to influenza. Not shocking there, because with everyone masking and social distancing and staying home more, it's not going to be a typical flu season. You're not going to see that spread. There are cases out there. So it has been documented in the state of Wisconsin, but none of the regions are high right now. We anticipate that those numbers will go up as things start to open up. So we might actually see a delayed influenza season this year. Other than that, we finished out the Giving Tree. So that is over, and things will be distributed this week, hopefully, or at the start of next week. So we will be distributing to 3 area food pantries. I know that we have received about $2,000 in cash, and then we also had food and supplies. So we will divide that up equally between the 3 food pantries and make that delivery hopefully this week. Other than that, I think our other programs are on track. We are going to be doing foot care again for 2021. Lisa has agreed to come back, so we're happy with that. And we're going to be offering those foot care clinics twice a month. And I think, just the biggest thing that we're planning right now, things are kind of on hold with a lot of our programming, waiting to see when this vaccine is going to be coming in so that we can get those dates established, because our staff will primarily be focused on COVID vaccine once we get that. Questions?
Then we'll move to the financial report.
And then you have the November financial report in front of you. And when you look at this one, for the most part, just about every one of our grants should be spent down in its entirety. Our goal is always by the end of November to spend all grant funding, with the exception of WIC. WIC carries through the end of the year, so that one will be finished out at the end of December. And then a lot of our county funding we'll look at next month's, but a good chunk of that will go back to the general fund because it was untouched due to the excessive COVID funding that we received, and we were able to pay our staff for the most part with those dollars. Questions on the financials?
Then we will move to travel request and approval.
None.
Overtime.
So overtime, and they never give me this report. So our only overtime that we pay out right now is through our contact tracing grant. And that contact tracing grant went through December 31st. And the girls were averaging somewhere around maybe 4 hours or so a week for contact tracing. And that was pretty much dependent on who was on call for the weekend times that we were doing that contact tracing. Right now, we contact trace on Saturdays. We try to have that done by noon, and then we do not contact trace on Sundays. So our overtime, for the most part, especially compared to other counties, is pretty minimal. I heard a quote the other day on one of my teleconferences that one of the Milwaukee health departments was paying $200,000 a week for contact tracing. We are not there. County of La Crosse was paying $250,000 a month, so $250,000. So we're nowhere near any of that. Ours is quite minimal in comparison. And for contact tracing, we do have 2 college students that are still with us. So one will be leaving at the end of the month in January. And one is hoping that if she can work it with her school schedule, will stay on and do some evenings and some weekends with us. So we're hoping to keep her with us. So we'll probably be down to 3 additional staff at the end of January. And if our numbers continue to stay where they're at or go a little bit lower, I'm hoping not to have to replace Mariah when she leaves.
Any questions on that? Then we will go to our next meeting date. So we normally do the second Monday, which would fall on February 8th. Is that looking okay with everybody? Monday, February 8th.
Super.
Good?
Very good.
8, and we'll do 8:30?
Yep.
Yes.
Okay, so February 8th, Monday, 8:30. And we'll just be in the same room until we can move down to the lower level.
Hopefully soon.
I hope it's soon, yes. Any other matters, please? Then do I have a motion to adjourn? Kathy, a second by Virginia. All in favor, say aye.
Aye.
Oppose? We are adjourned. Thank you.
It is 8:55. Yeah, that's a problem.
Yes, it is. Yes. Are you able to help me out with that? Thank you. Thank you. Why I asked Cindy was. I called
Hi, Hannah.
and they said if it wasn't, already.
Thank you.
Yeah, it was very hard because
My husband
struggle
my
with
husband and I
is
need
it
to get on
starter?
the
Is
list
it the
for,
kid sitting on the bench?
you know,
Is it, you know what I mean? Because
And
the
they-
kid sitting on the bench didn't have.
the only way
Well,
to test
is if I
compared to the other people.
The nurse we had, she said, okay, they're running, they're not standing.
So how is the hotel business going? Lots of people there, Jeff?
Lots of people.
Really?
You see them lined up on the highway just as you're in the drive?
No, I did not look. I
Oh,
didn't
oh.
go to the north side of town. I'm on the east side of town, or sorry, west. Can't do east.
Say, how far east are you?
I'm on the west side. I came to the east to come to Kiwanee, so I'm by East Croc. So I didn't go north of Kiwanee, so I don't know how much.
East Croc, but west of me.
Right by East Croc. So that's good, a good business. I didn't know how this would be working out for you, sir, with concerns
The
and.
year overall was pretty typical once we got into the summer. Spring was uncertain.
I would think so, sir. What's your capacity for residential or people, apartment buildings or?
37 rooms.
Okay, okay.
And they were like,
So you normally have them relatively full every day?
that's why I was wondering.
I don't know about every
They
day.
run.
Okay.
they run
Weekends.
a little different.
Okay.
They're
Short season.
Okay.
Very short.
I suppose Packer games would help out in the past.
That is true.
Probably booked
How
the
was
year
your
ahead
meal
for
at
that, but
Billy's?
now with no Packer
Was it
games.
good?
Yeah, we,
Yeah, it was,
Packer
they were very
games-
good. We always have
Not
our Christmas
having
party
Packer
there,
games
so
is definitely.
it was very, very good.
I've been told that.
Chamber had a bus and everything.
of our
Oh, really?
get out ahead of time.
Because we
Well,
went,
yes, I've heard
Wendy
from
and
Packer
Tom
games,
invited
they-
us, and Jeff and Sandy.
It's
Go to
millions of
Kiwanee.
dollars. It's millions of dollars in the
sorry.
community.
I'm all
Between Green Bay
I've
and
never been
Appleton and
It's
Kiwanee.
been years, like,
You know?
Yeah, to stay overnight in
And it was
Kiwanee, oh,
very
that's
good.
nothing. That's close.
yeah,
That,
it
that's.
was really, we just went to
What's
eat.
35 miles or 40 miles? That's
nothing.
nothing.
It isn't.
That
You
was-
know, when you got a bus.
And home, because we both
There
had
you
to
go.
be up early. But there was a lot of people. Yeah.
Yeah, and then when they're doing as well as they are.
Yes, I was very, 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 very concerned
was
against
nice. I got to
Tennessee.
sit
And we
And
kept them in
relax.
check. And then yesterday.
We were gonna do that, and then they were like, "Oh, let's go to eat," and I'm like, I like to be home, especially when we have to be up. But it was fast, and it was very good. So yes. Oh, and I was on the whole time talking, or were you? Did you have me off? Yeah. I didn't even realize, but I was talking this way, so maybe I was good.
And I said, no, if you're quarantined, you don't leave the house for any reason.
Veterans meeting is still gotta take place.
Yes, yes, but it takes, she calls them and then they have to come, so
Okay.
it's a little bit. before you get there. So,
And she was on life support and they thought she wasn't gonna make it. So,
Isn't that amazing?
yeah, she was in intensive care for like 2 days.
Wow. Yeah, I don't know. But you know, I would never get tested. Ever.